Feliz Viernes, I'm Rory, hoy es Viernes, and man, I have just had at least an hour and a half right now of pure tech trouble. I couldn't get anything working. I had a couple computers going, and I'm just glad to be here with you today, finally get it going. I've got some meetings and stuff coming up. I've got to get on the road in about 30 minutes, so can't take too long, but I wanted to take a moment to, talk about, I'm just really thankful that you're here with me today because, when I think back at the events of this last month, millions of people here and American citizens trying to put their lives back together after hurricanes, our friends and partners right now in Central America dealing with crazy flooding with the next tropical storm and the horrible events, horrific things that people went through this past week in Las Vegas. I think about hope, and I think about hope being the one thing that pulls you through and pushes you forward as you get through difficult times. And why am I thankful for you? Well, because when you're working with patients who are dealing with uncertainty in life, uncertainty in their own health situations, uncertainty in their, family situation here in the U.S., and you're able to meet with them and connect with them and work with them in Spanish, you give peace and you spread hope. And I think that's it's a big deal. And so I'm thankful for you being here with us today. So we're on lesson number 2 of depression. Today we're talking diagnoses y tratamientos. And I guess hope is a relevant topic with this as well. Anyway, esperanza. So, video viernes, conversando sobre la depresión y los tratamientos en español. Para empezar, to get us started, let's take a look at some vocabulario. And so vamos a hablar sobre varios trastornos or diagnoses de depresión hoy. A few different depressive tipos de depresión. So primero, trastorno depresivo grave. Remember, trastorno is a disorder in any kind of mental health context, okay? You're not going to use the word desorden. That's not the best word for any kind of disorder. Desorden is disorder, but it's really more like disorderly, a room or something that's messy. That's a desorden. But a trastorno is a mental health disorder. Bien, trastorno depresivo grave. So tenemos trastorno distímico or distimia. Tenemos depresión psicótica. Tenemos trastorno afectivo estacional. So afectivo estacional is seasonal, and so we talked about this a couple weeks ago actually with our fall illnesses, but trastorno afectivo estacional, SAD, seasonal affective disorder. Bien, when we get into these, we're not going to get too technical in their description at all, which is fine because people like me need layman's terms descriptions of things. Bien. Okay, y trastorno bipolar, of course. Un poco más vocabulario, things you'll see pop up throughout our lesson today. Primero tenemos desaparecer, disappear, the verb to disappear. Estado de ánimo, which is mood. Incapacitarle, which is the verb to incapacitate, and that le here at the end, the le, indicates who it's incapacitating. So something incapacitates me. It's just like something hurts me. Me duele, me incapacita. Okay? And interferir, interfere. Tenemos medicamento, medications. Melancólico, melancólico, sad, see, or melancholic. Padecer, padecer, and that's often padecer de. Padecer is to suffer from or to have something chronically, ¿verdad? So padecer. Psychotherapy, where are we here? Oh, pasajero. Pasajero, now in a transportation context, pasajero is a passenger, but in this context, when we talk about illnesses and symptoms that are pasajeros, we mean that they are temporary. They come and go. They're pasajero. Psicoterapia, psychotherapy. Sentimientos, feelings. Tenemos sentirse, the verb to feel. Tenemos trastorno, disorder, like we talked about. Tratamiento, treatment. Y tratar, the verb to treat. Y triste, sad, ¿verdad? Okay, so un poco de vocabulario. When, we've got a lot here, but in our Facebook group, I put the link for you to download the notes, so you can just print this off and make notes yourself, okay? Bien, not have to write it all down. So, un poco vocabulario en acción. Síntomas de depresión. Usted tiene sentimientos persistentes de tristeza, ansiedad o vacío, anxiety or emptiness, ¿verdad? Ansiedad o vacío. Sentimientos de desesperanza, feelings of hopelessness, sentimientos de esperanza. Sentimientos de culpa, inutilidad, feelings of, remember culpa from last week? Guilt, or inutilidad, uselessness. Irritabilidad o inquietud, irritability or restlessness. Usted tiene pérdida de interés, loss of interest. Pérdida de you can use for many contexts, loss of appetite, etc. Pérdida de interés en las actividades o pasatiempos, pastimes, hobbies, que antes disfrutaba, that you used to enjoy. Incluso las relaciones sexuales. Okay? Relaciones sexuales, relaciones is a polite, delicate term to talk about sex, so keep that in mind. Fatiga y falta de energía. Fatigue, lack of energy. Dificultad para concentrarse. Dificultad para recordar detalles. Y tomar decisiones. Now in English we make decisions, but in Spanish you take decisions. So that's why we have tomar decisiones here. Dificultad para tomar decisiones. Insomnio, despertarse muy temprano, wake up early, or dormir demasiado, sleeping too much. Comer excesivamente o perder apetito. Pensamientos suicidas, so thoughts, suicidal thoughts, o intentos de suicidio. Dolores y malestares persistentes. So dolores, pain, malestares. Malestares are, malestar general is malaise, so general malaise. Malestares, it's mal, bad. Estar, I guess it's just badness. I can't think of the right word in English for malestares persistentes. Dolores de cabeza. Son of a gun, we just got through it. And I missed the last one. Let's see if we can go here one more time. Bear with me, continuing to have tech problems today. Y dolores, malestares persistentes, dolores de cabeza, headaches, cólicos, problemas digestivos, digestive issues, problems. Okay, now hablando diagnosis de depresión. Before we get started, we talk about normal swings in mood, estado de ánimo. So let's see what could be something to talk about. It's normal sentirse melancólico o triste de vez en cuando, at times. Pero los sentimientos de tristeza usualmente son pasajeros. Here's pasajero. Are short-lived. Desaparecen en unos días, and they go away or disappear in a few days. Un trastorno depresivo no es pasajero, is not pasajero, y los sentimientos de tristeza, the sad feelings, no se desaparecen, don't disappear in unos días. Depresión interferes, depresión interfiere con su vida diaria e interfiere con sus relaciones familiares. So that A there is E, and interferes with your family relationships. Bien? Ok, entonces, vamos a empezar con el trastorno depresivo grave. Okay? Major depressive disorder. Es una combinación de síntomas que interfieren con su capacidad para trabajar. So, a combination of symptoms that interfere with your ability, capacidad para trabajar, work, dormir, sleep, estudiar, study, comer, eat, disfrutar actividades, enjoy activities, ¿verdad? Here we go with incapacitarle. Le incapacita a uno. Le incapacita a uno. It incapacitates you. Puede ocurrir solo una vez en la vida. It could occur only once in life. Pero normalmente recurs durante toda la vida, throughout life. Diagnosis, continuado. So, trastorno distímico, dysthymia in English, right? Okay. Síntomas depresivos de larga duración, años, pero menos graves que la depresión grave. So, longer duration, but less severe than major depression. No le incapacitan a uno. They don't incapacitate you, pero impiden la vida normal, but they impede normal life. Uno no se siente bien. One doesn't feel well. You don't feel well. Okay. Depresión psicótica. Like I said, these are not super technical descriptions, but give you a little bit of layman's terms information to talk with your patients about. Depresión psicótica. Cuando depresión grave está acompañada con, is accompanied by, una forma de psicosis, ruptura con la realidad, breaks with reality, alucinaciones, hallucinations, o delirios, delirium. Trastorno bipolar. Cambios cíclicos, so cyclical changes, que alternan, that alternate entre estados de ánimo muy elevados, estado de ánimo, mood, muy elevado, manía, y estados de ánimo muy bajos, depresión. Again, forgive the brevity here. Depresión posparto. Un episodio de depresión grave en la mamá en el primer mes después de dar luz a su bebé. So, dar a luz is give birth, ¿verdad? So, un episodio de depresión grave en la mamá en el primer mes, in the first month, después de dar luz a su bebé. Cambios de estado de ánimo en mujeres después de dar a luz son normales por las hormonas. So, changes in mood are normal in women who've just given birth because of changes in hormones, nuevas responsabilidades, new responsibilities, y cambios físicos and physical changes. Pero depresión postparto es más grave que la melancolía postparto. So baby blues could be talked about as melancolía postparto. And the point here is that depresión postparto es más grave que la melancolía postparto. All right, bien. Trastorno afectivo estacional. Depresión que principalmente aparece durante los meses de invierno, cuando hay menos sol, when there's less sun, y los días son más cortos, the days are shorter, ¿verdad? Normalmente los síntomas desaparecen, normally symptoms disappear en la primavera y el verano, in the spring and in the summer. So, los meses de invierno, in the months of winter, ¿verdad? Cuando hay menos sol, there's less sun, y los días son más cortos. Okay, bien. So those are basic descripciones of a handful of depressive disorders. Ahora, talking tratamientos. Tratamientos. We have some medicamentos antidepresivos, okay, antidepressants. Y tenemos, this gets a little technical and maybe you won't talk about this, but here it is anyway. Inhibidores selectivos de recaptación de serotonina, okay, SSRIs. Por ejemplo, Prozac, Celexa y Zoloft, okay. inhibidores selectivos de recaptación de serotonina y norepinefrina. Por ejemplo, Effexor y Cymbalta. Y tenemos tricíclicos y tenemos inhibidores de monoamino oxidasa. Okay? So, not giving many examples there, honestly, because when I looked them up, I didn't recognize any of them. Okay, bien. Apuntes, a few notes about medicamentos antidepresivos, things you might find yourself talking about with your pacientes. Es muy importante tomar los medicamentos como están indicados. So taking your medications as prescribed. Todos los días, sin falta, a little bit of that vocabulario, right? Cuando empieza un medicamento nuevo, when you start a new medication, es normal tardar hasta 3 o 4 semanas. It's normal to take 3 to 4 weeks para experimentar los efectos del medicamento, to experience the effects of the medication. Now, experience is experimentar. It looks like experiment, but it's actually the verb you would use to say experience, okay? So, es normal tardar hasta 3 o 4 semanas para experimentar los efectos del medicamento. Talking about, you've got to be consistent with this for, up to a month before you start feeling better. Okay, bien. Now, talking about terapias. We had a quick one on medicamentos. Now we'll talk terapias, therapies. So, dos tipos principales de psicoterapia pueden ser de corto plazo, short term, o de largo plazo. So, corto plazo entre 10 y 20 semanas, 10 to 20 weeks. Largo plazo, más tiempo. Okay? So, anytime you want to talk about long-term things, largo plazo or a lo largo, or short-term things, de corto plazo, or de corto plazo would be the best. Okay? Terapia cognitivo-conductal, cognitive behavior therapy, ¿verdad? Hay énfasis en enseñar nuevas maneras de pensar y comportarse. The emphasis is on teaching new ways of thinking and behaving. Ayuda a las personas cambiar sus pensamientos. It helps people change their thought patterns y comportamientos negativos and negative behaviors por un estilo de pensar y portarse más positivo. For a style of thinking and behaving more positive. Okay? Terapia interpersonal. Terapia interpersonal is the other kind of psicoterapia, which ayuda a las personas entender, helps people understand, y resolver relaciones personales and resolve personal relationships que pueden causar, that can cause, o empeorar, worsen su depresión. So, terapia cognitivo-conductal, cambiar la forma de pensar y comportarse. Terapia interpersonal, ayuda a entender y resolver relaciones personales que afectan su estado de ánimo, your mood. Okay, tratamientos complementarios, estilo de vida, lifestyle, okay? Bien, so tenemos things like rutinas y actividades. Tenemos practique actividades o ejercicios físicos moderados. Practique, do or practice activities or exercise moderado, moderate physical exercise and activities. Haga, do las cosas que solía disfrutar. Do the things that you used to enjoy. Solía es un verbo. Solía es el verbo soler. And of course, solía is in the imperfect past tense here. This is a verb you want to know. It's a O to UE stem changer, but it's an interesting kind of helping verb. It's the verb to normally do something. And so, por ejemplo, los sábados yo suelo cocinar un desayuno bueno. I usually cook a nice breakfast. Okay? Los veranos, mi familia suele vivir en Centroamérica. Suele vivir. Who knows how long that'll last with our kids getting older and getting more serious about their sports. But for now, mi familia suele vivir en Centroamérica durante los veranos. And so when we say que solía disfrutar, do things that you used to enjoy in this imperfect past tense, right? Okay. Participe en actividades religiosas y sociales en las que tenga una comunidad. So participate in religious or social activities in which you have a community around you. Okay, so some rutinas y actividades. Now, dieta y hábitos. So, comidas altas en omega 3, pescado, yogur, ensaladas. So, una dieta con comidas altas en omega 3 ayuda. Comidas altas en vitamina B, vegetales de hoja verde, huevos, legumbres, okay? Carbohidratos complejos, granos integrales, okay? So complete or complex carbs, granos integrales, y evite bebidas alcohólicas. All right. You probably have a bunch more that you might want to talk about with depresión with your pacientes. And so I would direct you to the National Institute of Mental Health. And this is a great page in Español where you can read about this topic that you already know a lot about in English, and you'll begin to make connections. And honestly, reading is a wonderful way for you to improve your Spanish kind of on your own, because you know about a particular topic already and you're reading about something that you're very familiar with now in Spanish, and you're beginning to make those connections. Oh, that's how I'll say this, that's how they say that, etc. So I use National Institute of Mental Health website to kind of guide me through some of this stuff today. So when you download the notes, you can hit this link right here and read all you want about depresión and otros trastornos mentales. Okay? Muy bien. Well, muchas gracias. Of course, if you're looking for more opportunidades con español, you can head to our website, Common Ground International, and we'll be glad to do what we can to help you in addition to these video viernes lessons. Have a great day. Keep up the great work with your pacientes. You really are spreading hope and giving people moments of peace to just kind of connect with them in español. It's great. Keep up the good work. Hasta luego. Hey, thank you for joining me today on this Video Viernes lesson. I wanted to invite you to join our community if you're not a member of the Facebook group already that I deliver these live lessons in on most every Friday. And also point you to the website where you can find a bunch more information about medical Spanish, whether that be courses or free materials for you, or finding a private tutor to work with you online or face-to-face. And also let you know about some amazing Spanish immersion programs, either you as a medical person or your significant other as working in some other industry, or your family. If you want to improve your Spanish and you have time and budget to go do some travel, our programs are pretty amazing. I think it'd be fun to work with you. And finally, if you have some document work at your clinic or at your hospital or within your setting that needs to be professionally translated, shoot me a message, upload your document to us, and we can get you a quick quote and help you out with your Spanish language documents as well. Have a great day.